Hello everyone, we welcome you all for the one more Facebook Live session today. Today we have Dr. Mounika ma'am, one of the best radiation oncologists in Andhra Pradesh, and she has expertise in using brachytherapy to treat all types of cancer in well-versed and using medical imaging equipments. Dr. Mounika ma'am is recognized as one of the topmost radiation oncologists in Guntur. Dr. Mounika ma'am completed her MBBS from Konasima Institute of Medical Sciences and Research Foundation from Mamalapuram, followed by post-graduation in radiation oncology from GSN Medical College and General Hospital, Rajahmundry. And Dr. Mounika ma'am is also has a keen interest in research and pursued a basic course in biomedical research from prestigious Indian Council of Medical Research. And Dr. Mounika ma'am has published several papers and delivered presentations in various scientific forums. We welcome you, ma'am, on behalf of AOI Bovedala Cancer Institute.
Thank you for your wonderful introduction.
Today we have Dr. Mounika ma'am to discuss about rectal cancer.
Okay.
I want to ask a few more questions about rectal cancer, ma'am. First and foremost, what is the incidence of CA rectum?
Actually, CA rectum, we can say that according to Globocon 2020 statistics, it's account for about 10% of all oncology cases. Its incidence is 10%.
And what are the etiology factors of CA rectum?
Yeah, it has many factors like some are modifiable and some are non-modifiable risk factors, and some are pre-malignant conditions, and some are dietary habits. These are various risk factors which causes carcinoma rectum.
What are the etiology factors for CA rectum?
The most common etiology or some are most common risk factors are some non-modifiable risk factors and some are modifiable risk factors, along with the pre-malignant conditions also we can see.
And what are the modifiable risk factors for CA rectum?
Yeah, modifiable risk factors. The name indicates which we can modify ourselves, like dietary habits. Like some are having habit of eating red meat, which are more prone for a CA rectum, and some are having with low fiber and high fat content. They are also more prone for a CA rectum. And some are modifiable. Alcohol and smoking also most commonly causes CA carcinoma rectum. So these are the most modifiable risk factors. I mean, which can modify. We can say that we can change our food habits in order to prevent them.
And what are non-modifiable risk factors, ma'am?
Non-modifiable risk factors or which we can't change, like family history. If there is any family history of CA rectum, which is non-modifiable, and it's most commonly seen in a decade of 5th to 7th decade, and males are most common, more prone for a CA rectum. So these are most non-modifiable risk factors.
And what are the pre-malignant conditions for CA rectum?
Yeah, pre-malignant conditions are HNPCC and FAP and inflammatory bowel diseases. So these are the pre-malignant conditions after some years, like around after 10 years or 20 years, which can convert into a carcinoma of rectum. So in order to prevent them, so there are preventive measures or screening methods are there in order to prevent them.
How do you present the complaints for CA rectum?
How do they present? Okay. Most commonly 60% of patients are present with rectal bleed. So most common presentations are rectal bleeding, and some are present with abdominal pain and some irregular bowel habits. Some have diarrhea and some are suffer with constipation and tenesmus, pain. These are the most common symptoms they present with.
Is every rectal bleed causes rectal cancer?
No, not actually. Most of the present with rectal bleeding only, but not every rectal bleed will cause cancer. It's not is not for carcinoma rectum. The most other conditions like hemorrhoids, they are also present with rectal bleed, and any rectal ulcers, they are also present with rectal bleeding. So not every bleeding from rectum is a cancer.
What is the prognosis or survival rate of rectal cancer?
Yeah, the prognosis or survival rate which depends upon the stage. if it is first stage, they have 90% of 5 years survival rate. And if they present with the second stage, it's a little bit decreased, that is 60 to 85% we can say. And they present with the third stage, we can say that 27 to 60%. As the stage increases, the survival rate will decrease. So if they present with the early stages, survival benefit is more, and late stages, they will decrease in survival rate.
And how do you investigate that?
Yeah, for investigations, we have to first a physical examination. When a patient come to our OPD with rectal bleeding, first we have to take a complete history, and since how long he's suffering with that complaints, and and we have to go for physical examination and rectal examination, rectal examination. If we can able to, we can able to do a rectal examination, or if patient is if we got any suspicious of growth, we can then go for proctosigmoidoscopy or colonoscopy or sigmoidoscopy, we can say. And for that, if we get any suspicious of growth, we can go for biopsy for confirmation. And for example, to know the stage, which stage, and how some of the presentation also will indicate stage. Some are present with iron surrounding structures involvement also. They present with that complaints. We can say that which stage they are in. For confirmation of the stage, we can go for nowadays MRI, CT, and nowadays we are going for it's a trend like PET CT. It's not only trend, because of the education of people. We have to go for further investigations in order to rule out is there any other cancer. Some come with OPD that ma'am, why don't you indicate PET CT? So some are indicated people also there. Why don't we go for PET CT? And yes, PET CT is also indicated. If it is early stage, it's not so. It's actually PET CT is a little bit higher cost, so it's not actually regularly we won't go for PET CT. If any other what previously I have said that any other surrounding structures involvement, then we can go for PET CT in order to rule out any other structure involvement. So then we'll go for PET CT to know the status of disease, and now also for staging purpose.
What are the treatment methods for CA rectum?
Yeah, first of all, if it is initial stage, we go for surgery, and if not, if it is able to go for surgery, for second stage also, we can go for neoadjuvant chemoradiotherapy followed by surgery, which shows complete pathological responses. So for early stages, we directly go for surgery. For when the stage increases, it depends upon the stage. So according to the stage, we have to go for a neoadjuvant CT/RT followed by surgery. And nowadays, trend recent advances also showing that total neoadjuvant therapy. We have to go for without any surgery. Actually, there is a risk of recurrence is most. Risk of recurrences will be there, but today's recent advances showing that total neoadjuvant therapy. We have to go for NACT/RT followed by assessment and then chemotherapy, and but basically patient should be under follow-up regularly, as and trials showing that the total neoadjuvant therapy is also one of the treatment modalities for CA rectum. We have to say that we have to give the option to patients total neoadjuvant therapy also showing complete response. And under follow-up, if you have any suspicious of recurrence of disease, then we will go for surgery. Otherwise, you should get under total neoadjuvant therapy for carcinoma rectum patients.
What are the prevention methods for CA rectum?
Yeah, prevention means what are the risk factors, those who have to prevent them, modifiable, as I previously I have said that modifiable risk factors dietary diet modalities we have to eat high fiber content with low fat intake, and cessation of smoking and alcohol. These are some more helpful to prevent the CA rectum.
So, thank you so much, ma'am, for your valuable information about the CA rectum. We thank you so much for your time also. Thank you so much, ma'am. Thank you all for your kind information. And thank you all for watching this video. For more interesting videos, please like, share and subscribe to our channel. Thank you.